We hope that you can learn more about the current state of COVID-19, variants, breakthrough cases, and others. Let's get to the housekeeping before we get started. Recording. Today's event is being recorded and streamed live on live Facebook on facebook.com/SFGovTV, SFGovTV Cablecast, Comcast 26, and Wave 26. Audio and video. We respect all participants in this convenient and want to create a safe space for all. By default, all participants will be muted and video will be disabled. Video will be on for speaker only. The ASL interpreter will be spotlighted for the duration of this event. To view the ASL interpreter as a larger thumbnails during the slide presentation, please click on View button at the upper right-hand corner of your screen and change to slide-by-slide speaker view. At that time, you can also use the center divider to enlarge one side over the other. Once the slide concludes, please return to speaker view. Media. We recognize there might be members of media joining us today's webinar. We will prioritizing questions from the member of the public during Q&A. Media will welcome to follow up with additional questions they might have at sfeocjake@sfgov.org. Please select the chat button at the bottom of your screen to send any question to Q&A KT10. Thank you very much for joining us. Now I would like to hand it to the moderator, DPH Director of Public Affairs, KT10.
Good afternoon, everyone. Thank you for joining us with this webinar. As COVID-19 is circulating out there, we know there are lots of questions also circulating out there as well. And so we hope that this will be an informative session for all of you. So with that said, I'm going to invite Dr. Colfax to begin his presentation with all of you, but we will reserve a bulk of the time for Q&A. So with that, Dr. Colfax.
Hi, thank you, Katie, and good afternoon, everybody. It's really good to be here to provide an overview of where we are with regard to COVID-19 in our city. Thank you, everybody, for joining. Looking forward to questions and some discussion. We do have some slides that I'll present just to give you a sense of where things stand, and grateful for our collective response during what's been a tough 18 months. And now this new phase of the pandemic is presenting many challenges for us in our community. Have the next slide, please. So as of today, we have over 41,000 cases of COVID-19 diagnosed in our city. And unfortunately, we've had 565 deaths. We are now in a fourth surge, and you can see that we have now about an average of 235 cases a day. And unfortunately, we are seeing another surge in hospitalizations with 97 people as of August 1st in the hospital. San Francisco has done a great job of vaccinating people. And again, thank you for your collective efforts in supporting vaccination. It is our ticket out of the pandemic. 70% of everyone in San Francisco has been vaccinated. That includes, in that calculation, people who are under 12 who, as you know, are not eligible for vaccine yet. We've total residents vaccinated, you can see over 667,000. 84% of people 12 and older, the people who are eligible for that vaccine, have received at least one dose, and 78% of people 12 and over have completed their vaccine series. So this is remarkable. This is one of the highest, if not the highest, vaccine rate of any jurisdiction in among urban jurisdictions in the United States. And because of this work and because of what people have done in terms of getting vaccinated, while this fourth surge will present challenges, we are in a much better place, and we will have many fewer deaths as a result of this vaccine coverage. Next slide. So on the left side of this slide, you can see our 7-day rolling average of cases, 235. So that is going in the direction of what we saw during our fall and winter surge, where we peaked at 373 cases. And you'll also note that that increase of 235 is extremely steep. See how that curve is almost vertical. This is because of the Delta variant and because it is so infectious and rapidly moving through our city, including and especially among people who remain unvaccinated. We are seeing increases across the world. You see here from the New York Times, the reported increases in cases across the globe. And as I already mentioned, going back to the local situation, we have nearly 100 people in the hospital and are tracking those hospitalizations very closely. Next slide. In terms of our case rate, so this is case rate. Our case rate is now 24.15 per 100,000 people, a dramatic increase from our low of 1.18 cases that occurred just in June. So again, this rapid increase really attributable to the Delta variant, and the fact that we have reopened much of the city, so therefore there's more activity. So the combination of these factors are what's driving this increase. Next slide. So if there's no change in the current rate of vaccine uptake, and if there's no change in what we are calling San Francisco's current contact rate, which is how much we're interacting with the public and each other, then we project the following: that new cases will peak on August 20th with 410 cases a day. Hospitalizations will follow with a peak of 336 people in the hospital. And unfortunately, and these again are projections, so we are continuing to try to mitigate these numbers, the current surge would end with 257 additional COVID deaths in San Francisco. And with that last bullet, just to emphasize that the vast majority of these deaths would be among people who are not fully vaccinated, and that with vaccines, 95% of these deaths are preventable. Next slide. As we've seen throughout the pandemic, COVID-19 is having a disproportionate impact on different neighborhoods in the city. As in this slide, higher case rates in the southeastern part of the city in particular. The bluer the shade on this map, the higher the case rate in that community. So you can see here, southeastern part of the city, Mission, Tenderloin in particular have high rates. This is again something that we've seen throughout the pandemic, which is why from the beginning of the pandemic, working with many community partners, we at DPH have focused our efforts testing, prevention, vaccine access, support services in the neighborhoods most affected. Next slide. So there's been a lot of talk about the Delta variants in general during the pandemic. I've used the term several times already during this presentation. So just to be explicit about what is a variant. So viruses constantly change through mutations that create new strains of the virus. This is a natural biologic process. This happens with all viruses. A variant is a version of the virus that possesses mutations that differ from the parent virus. So many of these virus variants emerge and then disappear, while others have an advantage over the parent virus and they persist or become more common. So this is basically evolutionary biology. The virus adapts through what we call genomic surveillance. So genotyping, determining the gene sequence of the viruses, scientists can identify variants that are concerning that require further study and precautions. So public health in general, and certainly the Department of Public Health, becomes concerned about COVID variants when it affects COVID transmission, severity of disease, or has some impact on treatment or vaccine effectiveness. So you'll remember earlier this year, there was a lot of discussion about the Alpha variant that was more transmissible than the variant we were dealing with early in 2020. And now we're really focusing on the Delta variant, which we believe accounts for over 90% of cases now in San Francisco, is far more transmissible than even the Alpha variant. And there's indication that it may cause more severe disease, although the clinical research scientists are still determining whether that's the case or not. Next slide. So the most effective way to reduce emergence and the spread of variants is to reduce transmission. So if the virus cannot mutate if it is not reproducing, and it can't replicate without a host. And in COVID-19, the host are people who are infected. So this is another reason that vaccination is so key. The faster locally, nationally, and globally we get more people vaccinated, the less likely the virus will be able to infect more hosts and therefore less likely to reproduce and mutate. And the more likely it will be that we will be able to slow the spread of the virus. And again, as I've already said, the vast majority of hospitalizations and deaths due to COVID-19 are now preventable with the vaccines that we are providing here in San Francisco and across the country. Next slide. So vaccines are highly effective. They are incredible medicine. And at the same time, because no medicine is perfect, no vaccine is perfect, breakthrough cases are expected. And a breakthrough case is defined as people who are fully vaccinated who contract COVID-19. The case rate between vaccinated and unvaccinated individuals is highly significantly different. So right now in San Francisco, case rates are more than double among unvaccinated people compared to those who are fully vaccinated. So the vaccines are working. They are effective in preventing much transmission of COVID-19 to fully vaccinated people. And even more importantly, they are even better at reducing hospitalization and death due to COVID-19. And really, I've said this before, it could be the difference if you get COVID-19 and you're not vaccinated, if you're fully vaccinated versus not vaccinated. So if you're fully vaccinated versus not vaccinated, it could be the difference between getting a case of the sniffles and really experiencing suffocation and having to go into the hospital for COVID-19. So huge differences. I also like to say it could be a difference between spending some time in your bed at home and weeks in an ICU bed in the hospital. This is not to be taken lightly. These vaccines are life-saving and can keep you out of the hospital. And of course, prevent death. And this slide reinforces that point. Look at the difference here. This is the hospitalization rate per 1,000 cases in San Francisco. So these are our local data. You can see that the rate is 9.3 per 1,000 cases among people who are fully vaccinated, and a whopping 78.2 of people who are not fully vaccinated. So an over eightfold difference, 8 times more likely to be hospitalized if you are not fully vaccinated for COVID-19. So, there are some people who are hospitalized with COVID-19 who are fully vaccinated. Deaths are extremely rare among that group. And look at this difference between these two bars. Incredible difference, showing the effectiveness of these vaccines at the local level. Next slide. So I also wanted to touch base on the indoor masking order that our San Francisco Acting Health Officer, Dr. Navina Baba, and other health officials across the Bay Area issued on August 3rd, requiring masks indoors in public places regardless of vaccination status. This is a temporary measure that aligns with CDC guidance to reduce community transmission of COVID-19 and protect everyone due to the widespread COVID-19 Delta variant. So, this Delta variant is really COVID on steroids, which is why vaccinations are so important, but also protecting ourselves and each other, reducing the rate of transmission by requiring everybody to wear a mask indoors in public places is really another key step, particularly to protect people who have either not been fully vaccinated or who are not, haven't received a vaccine, and to provide more opportunities for those people to get protected through availing themselves of a shot. Next slide. So there's lots of resources here. We, again, are really focusing the health department on the most vulnerable communities to COVID-19, reaching out to ensure that people have the right information, the correct information, particularly about vaccines. There's a lot of myths out there and misperceptions. We are making vaccine as accessible as possible. In addition, there's information about where people can get tested. And then for people who want to delve deeper into the data, you can see the links here to our data and reports. And finally, just to emphasize, for further information about COVID, the state website and the CDC websites are here for you to browse at your leisure. And I believe that's the end of the presentation, and we'll have some question and answer, I believe now. Katie, I'll turn it back to you. Thank you.
Thank you, Dr. Colfax. And so if you have any questions, please do continue to send them through the chat to Q&A-Katie Tang. But before we get to those questions that you've submitted in the chat, we also wanted to welcome two of our incredible community liaisons who have been deployed as what we call disaster service workers throughout the pandemic response. These are individuals who have worked in different city departments, and we have called upon them to assist us with all that's required to respond in this pandemic, and want to thank and acknowledge everyone who has been part of that. So today we have Iofemi Bryant, who normally works at SFMTA, has been doing a lot of outreach in the community, and Jessica Medina, who is also assigned at the Department of Emergency Management and also has been doing great work as a community liaison. So we'll start with Femi, who, Femi and Jessica both have heard many questions come up in the community as they've been doing the outreach. And so we've ask them to relay some of those questions with us today. So we'll start with Femi.
Hello, good afternoon, everyone. The first question that's coming from the community is, why is the Delta variant so deadly, and why is it so contagious compared to the original strain?
Hi, sorry, I was just muted. So can you hear me now? Yeah, so thank you for the question. And it's a really, really important one to answer as clearly as possible. So we know the Delta variant is much more contagious than the virus that we were dealing with before. And as I said, this is basically COVID on steroids. And basically what's happened is the virus has mutated so that it allows the virus to bind better to our cells and enter the cells in our body. So basically it has created a way to bind even more tightly to our cells and do it more quickly to infect us. So that's the key reason why Delta is so concerning right now. In terms of its causing more severe disease, there's increasing evidence that it is not only more infectious, but if you get it, you are more likely to have severe illness. That is not conclusive yet, but in talking to our UCSF colleagues, the clinicians and doctors there, there's emerging evidence and supporting evidence that that is the case. And unfortunately, that trend is what we're seeing locally. So it's a series of mutations that allow the virus to both enter our bodies more quickly and easily than the prior virus, and then a series of mutations that are causing the virus to create potentially more serious disease.
Great, thank you for that. Jessica?
Thank you, Dr. Colfax. Another question we have is regarding testing. We're starting to see a lot more people getting tested for COVID-19. Is the city going to ramp up testing again, especially as the mass testing sites have been closed?
Yes. So we ramped up testing dramatically in the first three waves of this pandemic. And right now we continue to offer testing, particularly in communities at highest risk, both through our Alamany sites, our drop-in sites, and our clinical sites in our department's health network. And right now we're seeing an increase in testing. At this point, we have not, that increase in demand has not outweighed our supply, but we are working with partners both within the city and across our healthcare system partners, Kaiser, UCSF, Sutter, and so forth, to expand testing. I know that people who have healthcare providers are experiencing some delays in both getting an appointment and some delays in getting test results back. So we're working to mitigate that as much as possible. We're also working to help people access home test kits, which are another tool that we haven't had in prior times, so that people can get rapidly tested. But we acknowledge that testing demand is increasing, and again, are working hard to expand testing options, testing hours for people, so that people can get tested when they need to.
Okay, great. Next, we'll go back to Femi.
Thanks for that. Why do some people who are fully vaccinated still experience severe symptoms and are also being hospitalized despite the small numbers?
Yeah, so I think that it's really important to look at the broader numbers in San Francisco. There are going to be some breakthrough infections, and especially with Delta, there are going to be some breakthrough infections. So when we talk about breakthrough infections, there are people where virus is detected who basically don't have any symptoms, but their tests would be positive, right? And then there are some people who have, mild to moderate symptoms. But I think we've all heard of people, and many of us know people who did what they were asked to do, stepped up, got full vaccine doses, and they got pretty sick due to COVID-19. And this is the fact that if they hadn't gotten the vaccine, it's highly likely they'd be much more sick, right? Possibly in the ICU, or possibly sick to the extent that they could have died. So I think we just need to look at the numbers and look at the rate of infection and severe infections. And as we keep emphasizing, if people are fully vaccinated, the likelihood of their getting severe illness, the likelihood of their being hospitalized is reduced dramatically. So I know, I know people who've gotten pretty sick who have been fully vaccinated, but we just need to look at the facts. And the facts are that right now, because so many people in San Francisco are fully vaccinated, many, many fewer people are going to get sick. And the fact is also with Delta here, it's really important if you're not fully vaccinated to get fully vaccinated, because it could be life-saving. And if you do get COVID-19, it's incredibly likely that it will keep you out of the hospital.
Okay, great. Next question.
My next question is, what is the general guidance with regards to testing currently? What about isolation and quarantine resources if people test positive?
Yeah, so in terms of getting tested, there are a lot of different circumstances, so I won't go into those details except to say, certainly if you have symptoms that are consistent with COVID-19, you should get tested whether or not you've been fully vaccinated, so really important. And if you are symptomatic, It's important to wear a mask indoors, even in private settings, if possible, until you get the result of that test. In terms of isolation and quarantine, people should quarantine until they get the result of that test as much as possible, and isolate for the vast majority of people, isolate if they've had a positive test for at least 10 days until they don't have any additional symptoms. Our work is continuing to ensure that we can provide isolation and quarantine support for people. In some cases, this would mean support at the place where the person is living, or with supporting their family, supporting them with resources, or providing a room for people to go to isolate or quarantine as necessary. And at the same time, we do not have the level of isolation and quarantine hotels that we had for these last 3 surges. So we're continuing to work with community members and others to ensure that we're prioritizing the isolation and quarantine resources that we do have for the people who are most vulnerable, for the people who really don't have another way of managing isolation and quarantine. And again, focusing on providing support for people in other ways so that they can isolate and quarantine as much as possible.
All right. Next question, Amy.
How safe is the COVID-19 vaccine in the long haul? People are scared of the variant, but some are afraid of the vaccine and the long-term effects as well.
Yeah. So, I hear that concern, and I've talked to many people about it. So, the COVID-19 vaccines were developed and approved quickly, which is actually a great thing because they're our way out of this pandemic. But I also think while the vaccines were developed quickly, it's important to emphasize that scientists have been studying these viruses like COVID-19 for over half a century, for over 50 years. So while the vaccines were developed really fast, the science that really drove how they were developed has been in existence for many, many years. And this was done quickly because there was an unprecedented support and investment in this scientific research. So right now in the real world, the vaccines have been distributed to millions and millions of people, and they are safe and highly effective. We obviously don't know 10 years out from now what the effects will be, but all indications are that these vaccines are safe, and the risk of long-term complications from COVID-19 far outweigh the risk, the theoretical risk of any side effects from these vaccines. So just to emphasize that. Now, there's also, this concern about when I get a shot, especially if I get a second shot, I have symptoms, I feel fatigued, I feel sore. I mean, I got the 2 shots, my arm hurt pretty badly after the first shot. I felt down for a day when I got the second shot. You're achy, you feel like you have a mild case of the flu or a bad cold. I want to acknowledge that because it's not necessarily, for some people, it's not a comfortable situation, but I knew that this was going to protect me from COVID-19. And believe me, the symptoms of COVID-19 are far worse for so many and so forth about, the vaccines affecting your reproductive health, which is not the case. There's no scientific evidence that would be the case. The clinicians, the healthcare providers who specialize in reproductive health are recommending that people get these vaccines. In fact, there was just a study out yesterday that showed unfortunately for pregnant women who didn't get the vaccine, they were more likely to have their babies early, and the babies were what we call preterm babies, early babies. So that was a very negative effect of COVID-19. So the benefits of these vaccines far outweigh downsides. But I'm happy to have more conversations about it because we all know someone who got that shot and, got sicker than they thought, or, my brother got the shot, 2 shots, and then he had an asthma attack a week later, and he's like, oh, did the shot cause me to get asthma? I'm like, no. So I just want to be really clear about that and have some honest and candid conversations about it.
Great, thank you for that. And our last question from Jessica.
The last question is, we have heard that people who are fully vaccinated test positive for COVID-19. How long after finding out they test positive for COVID-19 should they then test again?
So again, this is a situation where if people have tested, so if they're fully vaccinated and tested positive, basically you need to isolate for the 10 days until you don't have symptoms, assuming you don't have any symptoms after 10 days. And then there's no further recommendation to get retested again. And if you do get symptoms similar to COVID-19 after that, again, the best thing to do is to talk directly to your healthcare provider. But in general, there's no reason to get tested after the 10 days from the date of your positive test. So the most important thing is if you do test positive, to isolate, to wear the mask, and for goodness sakes, if you have friends and family who haven't been vaccinated yet, get them vaccinated. Support that they're getting vaccinated, I should say.
All right, thank you so much to Jessica and Femi for all of your work in the community. Again, as you've heard, probably many similar questions that you all have that they've been fielding in the community. So thank you, Femi and Jessica. So now I'm going to go to some of the questions that you've all put in the chat. Thanks so much. I don't think we'll be able to get to all of them, but I'm also going to try to combine the ones that are along similar subjects. And so one thing that that has been asked is whether the city will shut down again. And will the city take any further measures to reduce transmission, such as closing indoor dining, bars, gyms, or requiring vaccination to enter high-risk settings? And do we anticipate us going back to the tier system or another shutdown? So essentially all of these questions are, are we going to shut down again?
Right, so we have no current plans to quote unquote shut down the city again. I think what we're really trying to do is to mitigate the effects of the virus in ways that allow us to resume the activities that we miss so much and love, while also trying to slow the spread of the virus and prevent the most serious consequences, hospitalizations, and of course, death. So vaccines are key to this. As I've said multiple times here today already, they are a ticket out, combined with people wearing masks indoors. Very important. The masks are not as effective as the vaccines, but they're another tool that we know works to slow the spread of the virus. The other thing that we're doing is mandating vaccines in certain settings, including in healthcare settings. And I think as people know, the city as a whole, the city is requiring employees across departments to become vaccinated. So there's multiple steps to ensure that we make vaccines as available as possible. Drop-ins at our clinics, we actually will bring the vaccine to you now. In your family, if you have 5, or your house, if you have 5 or more people ready to get vaccinated, we can make that happen. And the other part, though, is now that we've made it as easy for people to get vaccinated, we support efforts to make it hard for people not to be vaccinated, right? So very supportive of vaccine mandates, as we have seen large employers requiring, both in the healthcare setting and outside of the healthcare setting. There are a number of bars and restaurants that are exploring this now, requiring people to show proof of vaccine status. And especially in places where we know COVID-19 with the Delta variant is spreading rapidly in our city right now. So those include crowded indoor areas, including places like bars, supporting those institutions to require proof of vaccine status, I think is going to be really key going forward. Okay, great. And of course, we've seen a lot of these questions in the news and a lot of questions in the chat about quote unquote booster shots. And so I'm just going to combine a couple of these questions here. What's the cost benefit analysis for those who might want to get a supplemental shot if they're already fully vaccinated? How effective is a first vaccine dose of Pfizer and Moderna against the Delta variant? And what's the criteria if someone wants to get a supplemental shot? They read the news about SFDPH affiliated facilities accommodating those requests. Sorry, I'm just going through all the different related questions so that we can tie those in together. And then do you recommend people who had one type of shot getting ones from another company? So similarly, if you got Pfizer, now getting Moderna or Johnson & Johnson, and do we anticipate a booster vaccine shot? So many questions, similar topic. What are your thoughts about supplementals and booster shots, Dr. Colfax? All right, I'm trying to hold all those questions rapid fire there. So a couple of things. Starting with one of the questions that was in the middle there was, how effective is one shot of Pfizer or Moderna against Delta? It's not great. So that's why we are really want people who have gotten one shot of either Pfizer or Moderna to get that second shot. It's really, really important that people get that second shot. To the question of boosters, there is currently no recommendation from any major healthcare body in the United States that I'm aware of, including the CDC and the FDA, that people get boosters. So I know there's a lot of discussion, there's lots of questions about this. Right now, we all need to focus on helping support the people who haven't gotten any vaccine, haven't completed a vaccine series to get the shots, that one shot of J&J or the 2 shots of the Moderna or Pfizer vaccine. Those are the current guidelines. And the health department has not changed its policy with regard to that. Now, there's a lot of data. There's actually some data just out today with Moderna. There's a lot of discussion with Pfizer around booster shots, which would be additional shots based on evidence that people would need them. There are some countries that are either exploring or planning to start booster shots in certain populations. That is not happening in the United States right now. We don't know yet. It's entirely possible that booster shots would be recommended, but again, in the United States, that's not the case. Now, there has been some publicity about an accommodation that the health department made, which is giving if people who receive the Johnson & Johnson vaccine, which is a good vaccine, request an additional shot with a Pfizer or Moderna vaccine, that we will accommodate that. But it hasn't been a change in our policy. But if people have talked to their healthcare provider and say, I'd really like to have an mRNA shot in addition to the Johnson & Johnson shot that I got, we will accommodate that. But that is, we're accommodating that because we heard from community that people were concerned, that they were requesting it. We wanted to be responsive, and we wanted to accommodate what people were asking for in that regard. But it's not a change in policy. We're not recommending it, and we're not promoting that as a way for people to become more protected.
Okay, thank you. I know, so super helpful given just all the questions swirling around that and the news coverage, so thank you. Question, especially with Delta and other variants, do you recommend upgraded respiratory protection For example, N95 masks for unvaccinated individuals in indoor settings. So again, this is for unvaccinated individuals in indoor settings.
Yeah, what I recommended for unvaccinated individuals in all settings is to get vaccinated. I think the mask, we know the masks work, we know that, but they don't work as well as the vaccines. In an indoor setting, I mean, the more, the better fitted the mask. We know that N95 masks can be better for people if they're worn properly than other masks, than the surgical mask. But really, it's both about getting that vaccine with Delta here. And, if many people can't tolerate wearing an N95 mask for very long inside. So if it's better to wear a surgical mask than certainly no mask at all. But I know that with the masking, the indoor masking mandate coming back in, that did appropriately focus our attention on masks. But I also want us to not lose sight of the fact that the vaccines are so important, so protective, and easy to get right now. So both masking and vaccine are key to our getting out of this next fourth surge.
Okay, great. We had some questions about some of the other variants. So for example, the Lambda variant, we got a couple inquiries on that. Any Lambda variant found in San Francisco? What do you know about this variant? And also, I guess there have been some news articles out there saying that the Lambda and Epsilon variants might be vaccine resistant. So any insight on Lambda and other variants?
Yeah, so I think that, we're working closely with UCSF and other scientists, virologists, looking to ensure that as much at UCSF, we have an outstanding lab that is really leading the region and the state in terms of genotyping. In terms of the variants that were asked about, I mean, those are questions for a virologist, but it's plausible that we'll see more variants emerge because we don't have high enough vaccine rates across the country. And we'll have to wait and see, if these variants cause more severe illness, if they spread as quickly or even more quickly than Delta. But for right now, I'm going to go back. I know I sound like a broken record, but the way to prevent these variants from emerging is to get vaccinated so that the virus stops. I mean, and slows down. And the more people who get vaccinated, the fewer people that the virus is able to infect, the less the virus is able to replicate, and therefore the fewer variants we get. I mean, this is the case for all viruses. And so the most important way for us to stop worrying as much about variants is to support everyone to get vaccinated.
All right. And we got some questions about whether we've seen any differences in outcomes. So for example, cases or hospitalizations between people who have received different brands of vaccines. So any differences observed there?
Yeah, locally, I'm not aware of any differences with regard to that. And again, I would just emphasize that all three, the research that has been published shows that all three of these vaccines are highly effective in reducing the risk of hospitalization and highly effective in reducing the risk of death. So to emphasize that repeatedly.
Okay. And I know we've had a series of town halls focus on youth and children in schools, but we do have a couple questions here in terms of the Delta variant specifically and its impact on younger children, like 3 to 5 year olds. Is it really safe to allow 3 to 5 year old children not wear a mask in childcare outdoors? What about the Delta variant and pediatric outcomes? Any sort of idea on the rate of children's positivity for those who are not yet eligible? So in other words, those who are under 12. So generally speaking, some questions along the lines of how COVID and the Delta variant is impacting younger children.
Yeah, so this came up in this has come up in our discussions with our clinical experts. And I think it's really important to emphasize that right now, the public health officers, pediatricians feel that it's incredibly important that we return our kids to in-person learning, and that this is thought that we can do it safely. And it's so important for the health and wellness of our kids, of our families, and our community. The best way that we can ensure that is for family members who are eligible for vaccine to get vaccinated. That will protect their children, and that can help protect the school. And we have local data that supports that. So in the last 18 months, of the children who were found to test positive for COVID-19 in the schools, all those cases were tracked back to the family. So I just think it's important for us to all do our part to support that. In terms of whether Delta causes more severe illness among kids, there's not definitive data on that at this time. In fact, I was just talking to a number of infectious disease experts, again, at UCSF. You may have read those reports in Louisiana about children's hospitals being filled with children with respiratory illness. That's obviously of concern. And there's also a lot of COVID-19 in Louisiana right now, much more than we have here locally. They have low vaccination rates. Their vaccination rate is somewhere in the range of, I think, 35% compared to ours, which is at 70% overall. And right now, there's just not any conclusive evidence about whether Delta causes more disease among younger children. Right now, the consensus is that children are even if children get COVID-19, that they will experience milder symptoms compared to adults. But again, this is, as we've seen during these last 18 months, this is an evolving field, and we're watching it very carefully. But again, we want to support schools reopening for in-person learning as safely as possible.
Okay, thank you. We got a couple questions about rapid testing and people advocating for that. And so I don't know if you want to share any thoughts about rapid tests.
Well, I think that, if people are able to avail themselves of using rapid testing, that's another important tool that we typically haven't had before. And I encourage people to use it. But also that, you very carefully follow the instructions. And if you have any additional questions, that you consult your healthcare provider. So just two important caveats to the use of home test kits. And again, they should not be a substitute for getting vaccinated. Getting tested itself doesn't get you vaccinated. You can test as much as you possibly can, and it's not really protecting you from the virus, right? So if you're testing, get the vaccine.
Maybe just a follow-up question on that, if you can describe for the public quickly the difference between the rapid tests and what we have traditionally had out there, where test results are sent to labs.
Yeah, well, I think there are a lot of different rapid tests out there, but basically the rapid test allows you to get the results in as short of time as 15 minutes, and those rapid tests are being used in many settings across the city and by DPH. So for instance, we're offering a rapid test at our shelters right now and at certain testing sites. So you get that result very quickly. The traditional tests that we used earlier are tests that take a longer time to conduct, and they can take a turnaround time of anywhere between about 24 and 72 hours.
Okay, great. We had a lot of questions in here, which are similar to the earlier one about, will the city shut down again? But people having questions about specific types of events. We're planning for events to be held outdoors, but with a lot of people. Should we continue to do that? Should we cancel them? Is there going to be a possibility that we will, as a city, recommend people reduce participating in social gatherings indoors or suspend large gatherings? Any advice you have on small private outdoor gatherings? And so in general, I think the questions are along the lines of, I think we've talked about safety in COVID era as on a spectrum, right? And so maybe you can shed light on that.
Yeah, I think it is on a spectrum, and people 18 months into this, I think we all know a few of these key things to follow, right? That first of all, get vaccinated if you're eligible for vaccine, right? Secondly, that masking, particularly indoors, helps prevent the transmission of the virus, including among people who are fully vaccinated. So that's key as well. And that, the more people that you're engaging with, particularly inside, the greater the risk of transmission, especially if there are adults there who have not been fully vaccinated. The other piece is we know that people who are older, particularly 65 and older, people who have comorbid conditions, are more likely to suffer from negative consequences from this virus. So I think we just need to all think through that and do our own risk assessment to make a determination about what we're comfortable doing. There's a big difference between an indoor gathering of 5,000 people whose vaccine status hasn't been checked versus an outdoor gathering of 25 people who are fully vaccinated, or people eating inside, either in a group setting, in a restaurant. If they're fully vaccinated, and the staff are fully vaccinated, there's a big difference in that risk compared to if they're people who are not vaccinated in that setting. So I think it's just really being attentive to your own risk, the risk of the people that you love and who are around you, and making the determination about what you're comfortable doing while supporting getting vaccine and while wearing those masks indoors.
And so along those lines, especially given the high vaccination rate of our population, do you have any insight on where you're seeing outbreaks in San Francisco? At least I think you might have mentioned a little bit earlier, but any particular places or demographics or clusters?
Yeah, well, I think we're seeing concentrations on the neighborhood map that I showed. We're also seeing larger numbers of people in the 25 to 35-year-old age group who are not vaccinated. That's our age group in San Francisco that is least likely to be vaccinated. So if any of you are 25 to 35 or know 25 to 35-year-olds who aren't vaccinated yet, please support them in getting vaccinated as quickly as possible. Along those lines, we're also seeing when we're asking people, their activities, we're seeing more outbreaks in indoor settings, including people who are frequenting bars. So that's another place where we're seeing more people. We believe we're getting more transmission. So it's basically younger people who have not been, there's a higher risk for younger people, 25 to 35-year-olds who have not been vaccinated, who are going indoors into crowded settings, where I think mask use is lower than it needs to be at this time.
All right. Well, I know we received many questions and we apologize we couldn't get to all of them, but we will try to, through our messaging out to the public and other venues as well, try to get as many questions addressed in those ways. Our website, sf.gov/getvaccinated, is available with many different resources on this topic. We also have a San Francisco COVID-19 website with more as well. But I will leave it with one more question, just in terms of, I know you don't have a perfect crystal ball here, Dr. Colfax, but many people are wondering about how we can live with this virus, in the long run, like we are living with a flu. And so what are your thoughts on that?
Well, I think, again, it's hard to project into the future, but we have the tools that work, the vaccine. And there's a question here about, if you get the vaccine, could it help create mutations? Would the virus reproduce in among people who get vaccinated? Not to the degree that among unvaccinated people. So the vaccine is key to keeping us from spreading the virus and from keeping us out of more serious variants. So I just want to emphasize that. I think in terms of where we'll be in the future, hopefully we'll get more people vaccinated. The masking, indoor masking will help us slow the spread of this surge. And then we'll have to see where we are in terms of the science around further vaccines and determine, if and when additional shots are necessary. But I think right now the most important thing that we know now is that these vaccines are going to be key, and that the more people we get vaccinated now, the more we will be able to mitigate and control the spread of this virus in our community and prevent people from dying. These are great medicines, and the vaccines are our way out.
All right. Thank you, Dr. Colfax. Thank you to everyone who participated in this event today. And if
I can just say one more thing, Katie, I just want to make sure that, this has been a long 18 months, and, I've talked a lot directly about the virus, but I also just want to emphasize that there's a toll of this pandemic on our mental health, our ability to care for ourselves and our family. And in addition to getting the vaccine, please make sure that you're taking care of yourself and your families in the ways that are so important for us to be able to be resilient and to sustain through which continues to be a really challenging time. Sorry to cut in there, Katie, but I just wanted to say that, and I'll stop now. Thanks, everyone.
Oh, no, thank you for those words, Dr. Colfax. And thank you to everyone who participated today, and SFGovTV as well. If you would like to share or review the recording, it'll be available on SFGovTV's YouTube channel. So thanks, everyone, and hope you have a wonderful day.